MiDR was built with the goal of increasing care coordination and the flow of information between medical and dental providers. MiDR is available on Oscar Professional and on the State of Michigan single sign-on MiLogin for third party. Medical providers and dentists can access Michigan's Dental Registry via the State of Michigan MiLogin system, and that's what I'll walk through today. Users must first request access to the application through the MiLogin system. Once you're logged in, click on Request Access. MiDR can be found under the MDHHS list of applications, or you can find it by using the search function at the top of the screen. We'll put MDHHS and MiDR is listed under that, or you can search here. New users must first create a profile by answering a few quick questions and signing the user agreement stating that they'll protect the information housed in MiDR. Once you've created a user profile, depending on the type of user you are, you'll be directed to the medical or dental page. I'm going to walk through how a medical provider will use the application, place a referral, and then how a dentist can communicate back to that provider through this tool. We'll launch the application now. First thing a medical provider will do, or a user at a medical clinic, is select their clinic from the drop-down menu. This drop-down here is populated first by the clinic that you inserted when creating your profile, but you can always add another clinic by clicking on the Add a Clinic, Add an Organization link, and then you'll be prompted to input some information about that organization and then submit to add it to the list you provided. Go here, add an organization, add that information. In order to look up a patient record, you'll need to look up the patient's 8 to 10-digit Medicaid ID and then press View Patient. If your patient's not in the system, you'll be prompted to add the patient by inputting their full name, date of birth, and sex. So I'm going to put in a made-up ID and press View Patient. Select Add Patient, and then you can add those details here. So we'll go ahead and put in a fake patient. You can put in an alternative phone number, but that's optional. You can indicate whether the patient's in foster care or if they have special needs. And then you can choose to add that patient to your list of patients on your home page. If you search a patient that's already in the system, MiDR will populate the rest of the page with the patient information and update the treatment information panel with any treatment provided to the patient. We can select here and put in an existing Medicaid ID. You can save frequent patients to the My Patients section by selecting Add to My Patients. This patient's already added. You can remove any patients from the list by selecting Remove. You can go here and select Remove. You can add that patient back. So you can now use MiDR to prepare for future patient visits by generating a patient summary report. This report can be printed out and attached to the patient chart, making it easy to identify if a patient needs fluoride varnish, an oral screening, or a dental home referral. If your patient has an existing referral in the MiDR system, you can click on that referral here and see if their dentist has updated recently. Watch that. Referral seen means that the dentist has opened up the referral. Accepted referral means that the dentist has accepted the referral and agreed to follow up with the family to schedule the appointment. In some cases, the dentist may update the referral with a scheduled appointment to let you know when they expect to see the patient. And the referral is considered complete when the patient was seen is selected. You can see the different statuses as well within the treatment information panel, which we'll speak about shortly. As you can see here, the referral has not been opened by the dentist, so there's no updated status here. The treatment update section is available to document the preventive oral health services provided. This calendar feature allows the user to select the date on which the care was provided. The default date is always that current date. Fluoride varnish should be applied to a patient every 3 months. This flag gives a quick indication of whether the patient is up to date on their fluoride varnish. A green checkbox means they received it less than 3 months ago. If you see a red exclamation mark, the patient is overdue. The options available for fluoride varnish are applied fluoride varnish. This means that the fluoride varnish was applied or you plan to apply it. Patient declined if the family declined fluoride varnish for any reason and not indicated. Should the patient not require fluoride varnish, for example, the patient doesn't have teeth or they recently received fluoride varnish elsewhere. We're going to go ahead and say we applied varnish, or patient, and we'll put it for a future date, tomorrow. I'm sorry, 1 second. The oral screening section has several options for input. The user can select the clinical findings from the dropdown. These selections result in chips that can be removed later if necessary from the selection down here. The link to the right of the dropdown launches a new tab that contains the AAP risk assessment. This resource can be used as a reference by users to understand what each of those clinical finding categories would look like in the mouth. The notes section is available should the user like to input additional notes to document findings or communicate care needs to other providers. The user will then click on Save to save their selections. The saved care is stored in the treatment information panel and can be referred to at any time after the visit. This treatment information panel contains all of the care provided. So you can see here, it's a database of oral health services provided regardless of setting. The dentist search and referral is a key component in enabling proper care coordination. Altarum Institute partnered with the Dental of Michigan to build a web service that allows MiDR to directly access their dental provider database. The user must select a reason for referral and can let the dentist know if the patient has special needs or has anything they need to note for the patient. So we're going to say they need restorative care, and if, for example, we need the patient to be seen relatively soon, that way the dentist knows that there's something might be going on and they should try to schedule the appointment sooner rather than later. There's both a dentist and name-based search, as you can see here. The user can input the address and press search to search by distance, or a name here to look for a specific dentist. The search does support a partial name search, so we can put in, as you can see, we have a lot of Smiths or Smiley. From the dropdown, the user can change the distance parameters if they'd like. And they can also search for a specific specialty. If a specialty is not selected, the search will default to general dentist. From the list of dentists produced, additional information can be seen by clicking on the information button. There you go. You can see language, hours of operations, whether the dentist is accepting new patients. Dental providers who have given Delta Dental information as to whether they are near public transit access or if they're accepting children with special needs are marked here in the access column. You also can see whether they're handicap accessible, and then MiDR itself will let you know who from this list is actually using MiDR currently. And so you can place a referral to a dentist who is already in the system and has higher likelihood of completing that referral. In order to process the referral, the user must select a dentist and then press Send Referral. You can choose to print the referral and process it per your own clinic process or send a fax. In this case, MiDR will send the fax directly to the dental office if the fax number is available. The letter that's sent via fax can be seen here. MiDR sends a standard letter with a referral ID that the dentist can use to look up the patient record. I'll scroll down and show you that. In the treatment details, you can also see Referral Summary. This can be printed and provided to the patient to take home. It's got information on the dentist that they were referred to, along with what the treatment was provided during the visit. Additional information can be found in the top menu. Frequently asked questions can be reviewed as needed. Contact us here can be used to send feedback to us through the application. And additional patients can always be searched using Medicaid ID and pressing View Patient. We recently introduced a new dashboard feature. This is where users can review their current rates of oral services. This can be used to compare user activity with overall clinic activity. At the top of the screen you see here, you can see how many dental referrals have been placed by this individual user, number of oral screenings completed, and the number of fluoride varnish applications applied. A breakdown of all the fluoride varnish applications versus not indicated versus how often a patient has declined can be seen in this pie chart here. And then the types of referrals broken down by age group can be seen to the right. The user can return to the MiDR application at any time by clicking on the application button at the top of the screen. There you go. Next, I'm going to walk through how a dentist can receive and review a referral and then update patient treatment as well. We're actually going to close here. We're going to use this referral ID here as I log into the dental account. As you can see, dentists can also access MiDR, or dental clinic users can also access MiDR using the same system, MiLogin third party. So we're going to launch the application. And the first thing dentist has to do is select their clinic from the drop-down menu. This drop-down is, as I said, with the medical user, populated first with the clinics that you inserted when you created a profile, and then you can add an organization as often as is relevant to you by clicking on the Add an Organization button. In order to look up a patient record, you'll need a referral ID that we will pull up in a moment, which will provide you, which was provided to you when a patient was referred to your clinic. You can also use a Medicaid ID by clicking here and then searching for a Medicaid ID. If the patient's not in our system, you'll be prompted to add the patient to the system, as we saw earlier. If the patient's already in the system, MiDR will populate the rest of the page with the patient information and update the treatment information panel. You also can save frequent patients to the My Patient section as seen here, and you can always remove patients as needed. Referrals that are placed to your clinic automatically populate this section here, and those patient records can be pulled up directly from this list. You can sort by referral status to get at patients that maybe don't have a status yet, or who have, so as for example, so you can get to referrals that you haven't yet updated. Okay, so we're going to go ahead and launch that referral ID that we saw earlier, that we used earlier. Patient. This patient's not on my list. I'm going to add to my patients. And similar with the medical clinic, I can pull up a patient summary, and this can be used to attach to the chart in preparation for that visit. Now we're going to see how we can update the referral status. So here, now that we launched a referral, we can see information about the physician who placed that referral, their full name, and their contact information, along with the reason for referral. Referral seen means that I've opened the referral. Accepted referral means that I accept the referral and agree to follow up with the family to schedule the appointment. In some cases, the dentist may update the referral with that scheduled appointment. And then if patient was seen, then the referral is considered complete. So I'm going to go ahead and say that I've accepted the referral. I'm working on scheduling that appointment. And I'm going to say, now, say this is a future date, and now the patient was seen. Save again. And that referral sorted into the completed section. And then I want to update the record with what was done. The treatment update section is available to document the preventive oral health services provided, as well as now the dental treatment. That calendar feature is available. I can use it to select a date on which the care was provided. I'm going to say that I saw the patient today. Fluoride varnish is not indicated since this patient's up to date. I have access to the same AAP clinical findings overview so that I can understand how the physician may have categorized what they saw in the mouth. And I can update the treatment provided. So restorative care. I'll do preventative and restorative care. Okay. Now, as you can see here, treatment information, all of the care that I provided will be updated here. So I can see the patient statuses that were changed along with the referrals. Because the care is provided in the same date, the dental care that I just documented is below here. I have no notes entered, but my preventative care and restorative care is there as well. So this piece is key in allowing the communication between the medical and dental provider. It lets the medical provider know that the patient was seen and what happened during the visit. It allows the medical provider also know at what point in the referral completion path is the patient at, and it allows them to follow up with the patient and the patient's family as needed. That dentist search and referral component is also available here for dentists who may need to refer to a specialist. So looking for an oral surgeon, for example, that's also accepting Medicaid can be easy and can be done through here, and then that dentist can then follow up and schedule an appointment and communicate back to the dentist using the secure tool. So we're going to go up, and then similar to the medical user, they have access to frequently asked questions, user resources, patient education, and then the contact us button to contact us with any questions that they may have. There's also the MiDR dashboard. It's also available to dental users, where users can see their current rates of oral services. This can be used to compare user activity with the overall clinic activity in the dental clinic as well. They have the same counts available at the top, along with the fluoride varnish rates. One thing that's new and different for dentists is there's a referral status by clinic. This is only available at the practice level. So if I go ahead and scroll down and select practice, I can see here that this practice has received 8 referrals. And of those 8 referrals, there's various status. Referrals that have been seen or remain unopened are considered no status. Those are this gray bar here. Referrals in which the user marked them accepted or scheduled appointment are considered in progress, teal color here. And then referrals that were marked as patient was seen are considered as completed. The user can always return back to the MiDR application to resume their activity by clicking on this button at the top of the screen. So this concludes the MiDR tutorial. If you have any questions or concerns, please feel free to contact us at midr@altarum.org. That's spelled MIDR@altarum.org. Thank you so much for your time.